So let's say that a patient is having a anterior cervical surgery, either ACDF or fusion or a disc replacement. What would be your advice to them? They're getting ready for surgery. What should they know, and what advice would you give them?
The main thing that I would want them to know is that they probably are going to experience some kind of difficulty swallowing afterwards. It will probably be related to swelling. There is intubation that happens with that surgery, and that a lot of times will create some edema and swelling. So I think just knowing to expect that when you wake up from that surgery, you're probably going to have a little bit of trouble with your swallow. That's kind of the main thing. And maybe even with your voice as well for a little bit.
Okay. Okay, good.
And I think to add, you might want to make some dietary changes just straight off post-surgery. Maybe some softer foods, not going for that steak, but maybe going for, some oatmeal or something that just goes down a little easier.
So after surgery, they may want to plan on softer foods and to expect some trouble swallowing and possibly hoarseness of their voice.
Yes, I think that's great. Sorry, can I expand a little bit?
You can.
Other strategies I sometimes give people are just make sure that you're paying attention to what you're doing, going really slow with your meals, taking in smaller bites and smaller sips. Those can also help to kind of manage those symptoms and make it go down a little bit more smoothly.
We talk about being mindful with movement. Maybe we should be mindful with swallowing as well.
Yes.
Is there anything that the patients can do to prepare themselves, pre-operative exercises or other things that could make the post-operative swallowing problems better?
We were just learning about this technique where you can just move your trachea to the side a little bit in one direction and then the other way. So
maybe some mobilization exercises.
Yes, just a little bit of movement there can help to prepare.
One thing you did mention is that the patients that are on narcotics going into surgery have more trouble swallowing after. We've noticed they also have more problems with other things. So it reinforces the recommendation to try to get off of narcotics or decrease the dosages before surgery. So after surgery, what should patients be looking for to distinguish between this is just normal or this is a problem with swallowing?
Again, I think initially you probably will have some trouble. Just kind of watching how bad your symptoms are and whether or not they're getting better and making progress. If it seems like, okay, I'm not able to swallow water, or like she was saying oatmeal, like I can't swallow some of these kind of basic things, and it's just not improving, then I think at that point it is becoming more of a concern. Maybe give it a little bit of time, but also severity of your symptoms matters, and what exactly you're experiencing matters. And the longer that it goes on, the farther you get out from the surgery, that is also a consideration.
So if the symptoms are severe initially, and then if they're persistent,
yes,
then we would say, okay, something ought to be done. So let's say that we recommend the patient see a speech therapist. What are you going to do with them? Like, are you going to torture them? Are you going to stick needles in them and electrocute them? Like, what do you do when you see a patient that needs to have a speech therapy consultation?
Usually not.
Okay.
So what we do is first we need to look at what exactly is going on with the swallow. And so we'll do some imaging. We'll do an x-ray of the swallow and give you a few different things to try just so that we can see what exactly is going on. So we have a better idea of how to develop our plan of care, what exactly it is that we want to do with you, and what exercises we want to give you, and then also just whatever education and recommendations come from.
So that's a barium swallow study?
Yes.
And there's a cookie at the end of it. Is that right?
Yes.
Okay, I understood that.
It's a modified barium swallow study.
Barium.
The barium swallow study is different. So
okay, modified barium swallow, and you're looking at the swallowing under x-ray with a barium liquid.
Yes.
And then you can use that information to suggest a course of therapy?
Yeah, and normally that will also include exercises to strengthen, and also we'll give some stretches, and a lot of times we'll also do massage and things like that to get those muscles moving better and stronger and just better range of motion so that you can get a better swallow.
Well, I appreciate you speaking this morning, and I like to think that it's just the intubation that causes all the swallowing issues, but it's not. It's the surgery and the surgeon. And we move the esophagus over to get to the anterior cervical spine. And it's very common for the esophagus, probably from some swelling just caused by the surgery, maybe some fluid collections to cause some swallowing issues. And I think it's good to just recognize the risk of the surgery, almost as if it's a side effect in this case in some ways, and then recognize that with recovery, speech therapy should be considered for many patients, probably more than we really utilize the resource and get patients back to just swallowing normally, because it's hard when you can't swallow, you can't eat.
Yeah. It is really hard, and the social implications, I think, are also something to be considered. You know, when we eat, we often eat with people, and it's a social gathering, and so if you're the one at the table who can't partake with everyone else, you know, it can be isolating.
Yeah.
And so getting that quality of life back as well.
Love it. Thank you so much.
Thank you.